A luxury cruise ship is being held off West Africa because of a suspected outbreak of the hantavirus. 3 people have died, and passengers are being required to follow strict precautionary measures. Some of you plan to board a cruise ship this summer. Should you be worried? For more on this, we are bringing in epidemiologist Dr. Anne Rimoin from UCLA. She's joining us via Zoom. She is professor of epidemiology at the UCLA Fielding School of Public Health. Dr. Rimoin, it is always a pleasure. Thanks so much for being with me.
Thanks for having me.
First off, let's get your reaction to this. Is this something that people should pump the brakes on booking a cruise ship vacation come summer because of this particular outbreak?
Absolutely not. Listen, this is a very unusual event, which is why it's making headlines. We've never, to my knowledge, ever seen a case of hantavirus confirmed on a ship before. When we think about cruises, what we normally think about are things like norovirus or respiratory viruses. Those are things you worry about on a cruise ship, and cruise ships are used to dealing with these kinds of outbreaks. But this is a very unusual situation. Hantavirus, as you mentioned before, it's a family of viruses that are carried by rodents, and people usually become infected when they're breathing particles from rodent urine or droppings or something along those lines. So it's not something that you would normally hear about on a ship.
Okay, so when we think about norovirus, that's one of the viruses you mentioned being more associated with a cruise ship. That is a human-to-human spread respiratory. Is that respiratory? No,
Hantavirus?
No, something
Norovirus.
like
Norovirus. Norovirus is usually a foodborne.
Okay.
Illness, and it's contact as well. Those virus particles are very, very contagious, so it can spread very easily through surfaces.
Got it. That's the big difference then, because hantavirus is not as easily spread, which is a good thing.
Correct. So, as I said, hantavirus is a family of viruses. So we've seen hantavirus in the Four Corners region of the United States, and also here in California, in Yosemite. We've seen cases of hantavirus, and those cases are usually when people are breathing in these particles from rodent urine or droppings, or especially when dust is contaminated and disturbed in enclosed spaces. So we talk about sweeping in those areas and being cautious.
Okay, and we think about, you mentioned hantavirus has been present in the Four Corners. We think of New Mexico, Santa Fe. Mm-hmm. That is where people may recall that Gene Hackman's wife, she died from hantavirus. So this is spread through rodents.
Correct. And hantaviruses are actually found all over the world. So, but they're different strains, and also can present very differently. So the question here is, which hantavirus strain is it? How many of these people? We know that one of these people has been confirmed to have hantavirus. And the others, we don't know. They're still considered suspected cases. So I think this goes back to, and you and I have talked about this before, you have to be very thoughtful about when we're talking about this, what it actually means. And what it means right now is we know that there's one case and there's several other suspected cases, and we need to have a lot more information before we know exactly what we're dealing with. And how we need to interpret this in the future. Okay,
so this cruise ship right now is off the coast of West Africa. It's not being allowed to dock. How the World Health Organization is involved. How do you go about investigating this?
Well, there will be an investigation on board this ship. There are so many questions here. The question is how did who was the first case? How did this first case become infected? You've got a cruise ship that's been sailing for several weeks. And so was it a crew member that brought it on board? Is it rodents bringing it on board? Is it did somebody get infected before they boarded the ship? Did they get infected on the ship? Did they get infected because this ship has stopped in numerous ports, right? So there's so many different scenarios here, and we don't know which one it is. And then the next question is how are these cases, if they are all hantavirus cases, how are they connected? How many people have been exposed? And the real key here is also understanding if we are dealing with hantavirus, in fact, with multiple cases, as opposed to just one case, what strain is it? Because most of the hantavirus, most hantaviruses that are out there are not considered to be very likely to be transmitted from person to person. That said, there is one strain, the Andes virus, which is found in Argentina, has been associated with person-to-person spread previously. But, it's not a lot of data either. It's not that it is commonly associated. It just has been associated with person-to-person spread previously. So you can see we're in the early stages. It's important that we know what's happening, but we still don't have all the info.
Okay, so I'm literally looking on the news wires here. This just crossed a few minutes ago. I don't think this is anything new that you haven't reported. Let me just read to you what I'm seeing here. We know it was a Dutch couple, German national among the dead, so with three deaths. The World Health Organization says the risk to the wider public is low. You obviously agree with that. Let's see, passengers are being asked to stay in cabin as a precaution. And there's about 150 people who are stuck on the vessel after those three people, the Dutch couple and a German national, have died. And now the Netherlands National Institute for Public Health and the Environment, which is assisting with the outbreak, says that, as to your point, the hantavirus had been confirmed in just one of the patients showing symptoms.
And I believe that's the patient that's still alive and in Johannesburg.
Okay, that makes sense. That makes sense. So and there is no specific drug to treat the disease.
Correct. So it's supportive care, and getting care early is very important.
If for other cruise ships out there, or cruise lines, I suppose, is this a study case then moving forward on how this all plays out? I imagine, since it's not common that hantavirus has been associated with cruise ships.
Absolutely. I think that this is, every time we see something happen, we're always learning something new, right? I mean, that's just the way it is. And the world continues to change, and, people travel more and more. And so of course, we're going to learn something new. Science around this virus is not static. We're certainly going to learn a lot more. And now this brings up, for example, the issue of rats on ships, or rodents on ships. I mean, certainly we know that there are rodents on ships. So I think now, in particular, in certain regions, we're going to be wanting to be even more cautious. So these moments where we're having these unusual situations, and we may not see the same situation repeat itself, but we're certainly learning something very important. And we're going to have to, once we actually have all the information and it's not just speculation, we're going to have to really think about, well, what does this mean for the future? How do we prepare ourselves better in the future?
Let me ask you this. California obviously has a whole lot of, we're the biggest state. We have a lot of rodents running around. Why is hantavirus rare if there's so many rodents?
Well, the hantavirus is it's not actually completely rare. I mean, we see a certain number of cases a year. There are probably also cases that just go unreported, or cases that are less severe. We only tend to know about what's reported, what actually, to be able to have something reported, diagnosed, and then information disseminated requires all cases to seek care, and we don't always have this people seeking care. It's my understanding is that the first patient in this scenario, for example, there was patient number 1 that died April 11th, and I'm just reaching back into my head, so I might be wrong, but I'm going to come up with dates that are approximate.
Sure.
And then it was only when you had other patients become sick and potentially die, then we understood more of what was happening. And it was only this third case that was diagnosed with Hanta, right? And so, you can imagine that all over the world you have cases of disease that happen. People may be asymptomatic, they may not be very symptomatic, or it may never be diagnosed, and so you don't know what's happening. So
right. It could be a little confusing, I imagine, too, because it says here, and you know this better than anyone, that it begins with flu-like symptoms such as fatigue and fever 1 to 8 weeks after exposure.
Exactly. And so what we actually know about is always just a tip of an iceberg, right?
Yes.
So when we think about spread of disease, it takes somebody noticing and being able to diagnose it before we actually know that it's happening.
Got it. Okay. Well, bottom line headline here, obviously this is a really tragic story. It's awful that lives have been lost, and this investigation continues. A whole lot of unknown still. And if you're one of the 150 passengers who were stuck in your cabin, this is a nightmare. So let's hope that this gets finished and wrapped up soon, and more lives saved than not, of course. In the meantime, we'll be watching that, and we will thank you, Dr. Anne Rimoin, UCLA professor of epidemiology, for joining me on the Fox Local stream and educating us about the hantavirus. And if you have plans to go on a cruise, don't let this stop you. One more time, right?
No, absolutely. I would not make this is not a big signal for people not to go on cruises. I think that this is a very unusual event and very specific to the region and to and we don't even really have all the data yet.
Right, we don't know how it happened.
I do not think that this is any cause for global alarm. It is just an important and very tragic event, but something that we will learn from and be able to be even more cautious and prevent other diseases like this in the future, because now we have it on our radar.
Very good. All right. She is Dr. Anne Rimoin from UCLA, professor of epidemiology. Thank you so much, Dr. Rimoin.
It's my pleasure. Thanks for having me.